Gran Canaria has raised its coronavirus alert to the highest level after an explosion of cases, meaning tighter restrictions for Brits abroad. The popular holiday island will join Tenerife on level 4 from Monday morning, authorities have announced. This will see a hardening of rules in bars, restaurants, shops, cinemas and theatre, including capacity limits inside and outside. But, in what many will see as good news, there will be no curfew and no requirement to show a COVID passport to enter venues. Both measures, proposed by the Canary government last week, were thrown out by the island's Supreme Court. Do you have a view on this story? Let us know in the comments below. Blas Trujillo, the Canaries' health minister, confirmed the change of status on Thursday. He said Gran Canaria would rise to level 4 from midnight on Sunday, joining Tenerife. There is no change for the other islands. La Palma and Fuerteventura stay at level 3, Lanzarote, La Graciosa and La Gomera at level 2 and El Hierro is at level 1. The change in the level of Gran Canaria is based on the number of daily infections, as well as on greater hospital pressure. A spokesman for the Ministry of Health said, a report issued by the General Directorate of Public Health of the Canary Islands Health Service on August 4 states that the situation of SARS-CoV-2 transmission in Gran Canaria has been increasing very rapidly, so that currently the risk of transmission is very high. Between July 28 and August 3, 2nd, 155 COVID-19 cases were reported, with a daily average of 308 new cases reported. Sign up for our daily coronavirus briefing newsletter to keep up to date with all the essential information and changes at www.mirror.co.uk/email. The 7-day accumulated incidence (AI) rate has increased 12 points compared to the previous week and now stands at more than 250 cases per 100,000 inhabitants, although this indicator tends to stabilise. This same indicator, also in Gran Canaria, for the group of people aged 65 and over is at very high risk, as is the accumulated incidence at 14 days. In addition, the occupancy of ICUs is at high risk, going from an average occupancy of 19 beds for the week of July 21 to 27 to the current 32, together with the 32% increase in hospitalization beds. Therefore, together with the decrease in traceability and the increase in positivity, this island is raised to alert level 4. Infections are showing a downward trend in Tenerife but not enough to lower the alert level. Infections on La Palma are under control whilst hospital occupancy in Lanzarote and La Gomera is low. The tiny island of El Hierro remains in a clearly positive scenario. The Delta variant is being clearly predominant. On average in the islands it measures 80% with variations on each island. It has exploded in our own territory, said the health minister. But he added, despite the peak in cases, we are still the fourth autonomous community with the lowest incidence. The pressure on intensive care beds in the Canaries has, however, pushed the archipelago to fourth highest in Spain. On Thursday, 820 new cases of coronavirus were recorded, of which 422 correspond to Tenerife and 347 to Gran Canaria. The accumulated incidence at 7 days in the Canary Islands stands at 236.68 cases per 100,000 inhabitants and at 14 days 494.36 cases per 100,000 inhabitants. The average age of COVID patients hospitalized in the Canary Islands in the last 15 days is 55 and 51 is the average age of those admitted to ICUs. Around 25% of those who remain in ICUs are between 12 and 29 years of age. President of the Canary government, Ángel Victor Torres, said they were studying a uniform set of regulations to be approved in mid-August as the fight against coronavirus continues. Whilst the Supreme Court had rejected a curfew and COVID passports, other measures had been approved. The objective is to contain the pandemic and face the next few months, which are key for the economy of the islands, due to the high tourist season in the autumn and winter months, he said.